So let us continue Alan's keynote study streak. Today we discuss one important remedy from Alan's keynotes, which is mezereum. A very valuable remedy, especially in the damp weather, the weather which is currently going on across the entire country, India, and in different parts of the world wherever dampness or wet weather will be experienced. That time this remedy will be useful. But apart from Alan and some experiences which I'll put to it, which I'll add to it, about how and when you will prescribe this remedy, mezereum. The first line that Alan says is it is suited to light-haired persons, irresolute, persons of phlegmatic temperament. So you have a case which is, you know, a patient who is very much similar to appearance like Calcarea carb. In such a case, leucophlegmatic. Phlegmatic means someone who is either very lazy or the circulation is very tardy and slow. So it will work on those people who have a slow thinking or slow temperament or slow reaction powers, especially in the mind level. Then we have hypochondriacal and despondent, indifferent to everything and everyone, angry at trifles, perfectly harmless, and also angry at perfectly harmless things but is soon sorry for it. So many times in our clinics we experience patients that tell us that after getting angry I feel so bad. If we go behind this feeling, we may probably catch mezereum or sulfur. Sulfur is one of the top remedies mentioned in anger alternating with quick repentance in many of the bigger repertories. So glad to see some joinees in the session today. Dr. Rahul Raj, Prince Gupta, Dr. Medha Kapoor and Ashi 1601. So we are doing this Alan's keynote study streak. I am doing this in the past from 11th of June. I have been doing it, and some days I am taking 2 to 3 remedies, some days 5 remedies, some days 1 remedy, depending upon how I have been seeing in my clinic and how I have been experiencing curing them or seeing the relationship of those remedies. Today's remedy is mezereum. So, in the mind sphere, when we see Alan mentioning that there is a hypochondriacal nature, the patient is despondent, indifferent to everything and everyone, angry at trifles and angry at perfectly harmless things. So he is someone who will get angry at little things, but he'll also feel so sorry about it very soon, which is also the case with sulfur. So you go in the repertories, you find anger alternating with quick repentance. Whenever patient will tell you that as soon as I shout, I say whatever is there in my mind, but I feel sorry for it after a few minutes. That is actually anger alternating with quick repentance. In the earlier few sessions also, I have discussed about alternating states. You should go and see those sessions to find out how alternating states will be experienced in our clinic. Headache is mentioned in mezereum, very less prescribed because it's more of a skin remedy, more of a teeth remedy, more of a bony pathological remedy. But if you get a chance to prescribe in the head complaints, you will see that there is headache which is violent after slightest vexation, after getting angry, painful on slightest touch, and or it is especially on the right hand side. Right hand side again similarly we have a rubric in boric repertory, semilateral headache right side, semilateral left side. So anytime when you have a case of migraine and you don't know the which repertory to pick up, where to pick up, how to go further in the case, just refer a small repertory, go to a rubric And in boric repertory, this was my favorite when I started my practice. You will see there is a mention in head pain, semilateral right, semilateral left. Only 5-7 remedies are there. To begin with, this is good for you to understand. You need not refer bigger repertories all the time. Sometimes you can refer the smaller repertories. You will get the key remedies, main remedies, and you can proceed. But in the head complaints of mezereum along with the headache, there is another symptom mentioned in the next line, which is that the head is covered with thick leather-like crust under which thick white pus collects here and there. Hair is glued and matted together. Pus after time is ichorous, becomes offensive and breeds vermin. So we have something which is affecting the scalp. It can be impetigo, it can be psoriasis, it can be any eczema. But patients will land to us with the names of the disease if they have seen the dermatologist, if they have googled the names, or else if they land up without visiting them, without seeing those online stuff, you will have some symptoms in front of you, and it is purely on observation that you will see that there is this symptom which says that there is leather like crust in the head of the mezereum patient, which has lot of pus and it has been there for such a long time that there is infective process and there has been vermin breeding in it. So I am glad to see some new joinees in Instagram, especially Dr. Aniket Shinde, Janvi Purohit, Sheikh Nazir, and someone named Ponos2093. I don't know the name. But welcome to this Allen's Keynote study streak, and this is a daily studying of Allen's Keynotes, which I am doing by putting my experiences and how clinically you will see patients in your clinic by reading what is mentioned in the books. So some symptoms will be subjective, what the patient will tell. Some symptoms will be objective, what you will see and pick up from your analysis. Then you have in mezereum something which is toothache in carious teeth. So teeth are already decayed, and then there is something which is kind of decaying in there. The process of decay has started. Like the remedy creosote, they feel elongated. There is dull pain when biting on them, when they use them, when they chew them, and when they touch with tongue, it causes pain. Touch with tongue causing pain is reflecting the hypersensitiveness of the remedy. And when you see this hypersensitiveness in any remedy or in any patient, you should keep those remedies marked, and only then you will be able to prescribe with ease to such patients who require remedies which are also working on that sensitivity. So you have something that is aggravated by least touch on the tongue. And this sensitivity of mezereum, if you find in one area, you will find in second place. It means that it is sensitive throughout the entire body. The patient will also complain that he is sensitive to cold air. Like me, I am having a cold from the start of the air conditioning over here. So in this way, but I am not mezereum, I may be some other remedy like hepar or rustox for this phase. But as the things get accommodated, it goes off. So that is the beauty of understanding and picking up little things from patients and your observations. Patients will enter your clinic and start sneezing. Patient will enter your clinic and cover the nose. That is your observation which you should develop. And even without asking, you may just come to a group of remedies and you can just confirm from them. So you have toothache in mezereum, which is dull pain, especially when they bite, when they touch with the tongue, aggravated at night. better with mouth open and drawing in the air. This is a contradictory modality for mezereum. And the roots decay. In Merck sol, it is the opposite. So if you have, I have discussed this earlier also, those who have been attending my session regularly, they will come to know that I have discussed about the remedies that affect the bones and the teeth are the deepest acting remedies in the materia medica. To corrode a bone at that level is something which is exceptional. If a remedy has that intensity to decay, improving or it can cure the decay, then this is the remedy which will go deeper into the economy of the human body. That is what mezereum does for you all. So you have a remedy which is working on the bones, especially mezereum, where the long bones are inflamed, swollen, nightly pains going above downwards after abuse of mercurius, after venereal disease, caries, exostosis, tumors soften without any lot of disturbances. Pain in the periosteum of the long bones aggravated at night in the bed, least touch in the damp weather aggravates, which is almost similar to Merck sol and phytolacca. So you have something that is a close running of three remedies: mezereum, Merck sol, phytolacca. How will you understand what to prescribe, when to prescribe is on the modalities and the type of pain or the pathology, how it is developed. Let us go further. So we have some old timers who have joined us. Dr. Rishabh Gandhi is always there in my sessions. Dr. Dhan Meher and Akhil Billa, I have seen them in some sessions. So today's remedy which we are discussing is mezereum. The remedy acts on the bones, teeth, and of course the skin. Next we have covered almost 80% of the remedy, and last part remaining is the skin. In skin, when we see, there is eczema, there is itching, eruptions after vaccination. So you have the top remedy for ailments after vaccination. If there are skin complaints, think of mezereum. If there are some eruptive diseases, think of other remedies. There are basilinum, there is thuja, there is sulfur, there is anthem tart, there is silicea, which you should think of in other conditions. If there are skin complaints, think of vaccination ailments from mezereum. Ulcers with thick yellow white scabs under which thick yellow pus collects. So this is purely observational symptom. When you see a patient, he may or may not share with you that there is pus beneath the ulcer. He will just show you the ulcer deep down there. It is burrowing ulcer, it is causing pain. When you just lift the scab, or if you see it with a scalpel or with any object that you can lift or examine the patient, you will see that there is lot of pus beneath this is the case of psoriasis, this is the case with deep varicose ulcers, this can be the case with psoriatic patches which are lingering for a long time, eczema also. And what is the best part of understanding mezereum and when to prescribe is the next line that you read in Allen's keynotes, which is vesicles appear around the ulcers. So there is an ulcer and there is some small dots which are there around the ulcer. That will lead you to prescribe mezereum. They itch violently, burn like fire, like the remedy hepar sulf. Although in hepar it is very similar, although in hepar the ulcer will spread by creating a smaller ulcer besides it and then forming a big crater along with it. So there is mentioned in Auric and the other books, ulcers spread by coalescing. This means that they kind of create craters, like how you see in the rainy season on the road. There are 2-3 craters. The vehicles keep on moving and then the big crater is created which leads to a big pothole. This is how the hepar ulcer starts. Whereas in mezereum it is just a big ulcer and there are vesicles or small reddish pinhead size ulcers, or not ulcers, they are vesicles kind of filled with pus which are present besides it. They are shiny, fiery red and have an areola around them. So it looks like there is an inflammation process going on, and that points to mezereum. Linen or charpy sticks to the ulcers, they bleed when it is torn away. So as soon as it is torn away, it bleeds. This will be the case with many psoriatic cases. It does not mean that psoriasis requires only mezereum. Mezereum will be one of the remedies that you will need to give to psoriatic patients when this phase comes. When and how to give this remedy, that is mentioned over here. In the patient, when you will give is when he will develop this stage of peeling of ulcers, or there will be excess of oozing of liquid, or there will be pus collecting besides or beneath it, and when you try to pull it out, it will bleed. Next you have in mezereum eczema, intolerable itching aggravated in the bed from touch, copious serous exudation. So you have something that is kind of eczema which is also having lot of intolerable itching, and it can be the situation which is mentioned in the few lines before. There will be some small patches of vesicles around it like a circular motion, or it will be just kind of more of itching and he will get aggravated. He will tell you that when I go to sleep I get aggravation from going in the bed. From touch, from copious serous exudation. Neuralgic burning pains after zona. So after herpes zoster, where you have already given remedies like heparsulf, ranunculus bulbosus, sulfur, even mezereum, or some other psoric or deeper anti-psoric remedy where the cure is finished but there is pain which remains in that part. The nerves are hypersensitive. That is the situation where you should think of giving mezereum. Now you understand when I was speaking about mezereum affecting the teeth, affecting the bone, it means that it is having lot of deeper action with hypersensitivity. Mezereum is a remedy which will have aggravation from least touch, least cold air which aggravates it, and that is why it is indicated in hypersensitivity of nervous system or neuralgia pains or nerves of that area after herpes zoster. Child scratches the face continuously which is covered with blood. This is the case with impetigo, and I have had very good experiences with mezereum. The child needed mezereum and followed it up with the other remedy. So I'll probably take a skin workshop maybe sometime down the line after 2-3 months after the fever workshop which I am undertaking right now, and you will experience that in those sessions. So here what you see is child scratches the face continuously which is covered with blood, eruptions moist, itching, worse at night, inflammation and inflammatory redness of the face. Last and something which is of prime importance for you all to remember mezereum is that there is aggravation from cold air, cold washing at night, touch or motion, bad effects of mercury or alcohol. For epidemics occurring in January or February often call for mezereum. This is because of the weather conditions that was there at the time of proving it in some other country. It does not apply to India. But if you see the other aggravations, it fits the bill. Wherever you see such aggravations affecting the patient, think about mezereum. Compare is one of the best ways to understand the remedy. You can compare mezereum with causticum, guaiacum, phytolacca and rastox. So all these cases where there is nervous system disorders, skin related issues or kind of an aggravation in the night time or syphilitic type of aggravations, think of mezereum also. So this is one of the remedies, the only remedy that I plan to cover today due to time constraints. And tomorrow we'll meet again in the evening around 5:15 with another set of remedies. Maybe we'll take 4-5 remedies together. And there are only 40-50 remedies remaining from the LM's keynote so far to cover. If you feel that there are any questions running in your head to ask me about any case or any potency, any repetition, anything you feel like asking, please feel free to ask, and we call it a day and we see again tomorrow. So I think some old timers also joined the session, and I don't know whether they are still there. In real meaning, KSN, someone I don't know. So if you have any questions, please feel free to drop about any case that you have running in with you right now or anything that you feel. And most importantly, if you have not registered for the fever workshop, you can register for the fever workshop, which is starting 15th August. You're going to learn something about fevers, the different types of fevers, different remedies in fevers, how to prescribe, when to prescribe, which will be very important. So Dr. Akhil Billa, thank you for your question. And you have asked one patient repeatedly getting tonsils, every cold settles in the throat, dandruff, white powdery itching, flakes, remedy please. So first thing that you should note is that the patient gets cold and it settles in the throat. There are few remedies which will give you the direct meaning of what is mentioned. One of the remedies is Dalkamara. But if you go further and read that what remedies get affected in the throat conditions, there are remedies like Baraitacab, there is sulfur and Hepar sulf. So when you will repertorize the rubrics, you will find the rubrics for the case. You will see that throat cold taking aggravates, first rubric. Second rubric, you will go and find out about scalp. In the head, you will find dandruff or eruption dandruff. There will be some sub rubric of eruptions where dandruff or white scales is mentioned. Maybe you will come to a group of remedies. Sulfur will be one of them, Hepar sulf will be one of them. You should also think of Kali Mure because it has white itching flakes and it will also affect the tonsils, especially the second stage of inflammation. Why second stage of inflammation? Because it is not a remedy which will have furious inflammation like belladonna. It is a remedy which will have something that has happened over the last few days and now it is showing a lingering pattern of disease which is persisting. So Kali Mure I am suggesting for that. Similarly is the state of Kali Sulf, which has predisposition on yellowish discharge and it will show those type of discharges and complaints. So this case you can think of okay, he's chilly patient, thirsty and constipated. So you should think of Baraitaka very strongly, I would say. And you'll need to understand a few mental symptoms of the case. So you can find out more mental symptoms and if you can drop me a message, I would be more than happy to help you. Patient with both knee pain aggravated more when movement. So it's a case of osteoarthritis and I would suggest strongly that Dr. Somesh Mithun, you should probably give him the constitutional medicine, and with the constitutional medicine you should probably give him osteoarthritis nosor 1 m every 3 to 5 days, one dose. This is going to tone his joins in a way with the constitutional medicine to give him a push to work effectively better. All the pains of osteoarthritis patients have kind of palliate. We can just palliate this condition, we cannot cure it. That you have to understand first. I have been palliating them with osteoarthritis nosode on and off, infrequent repetition with the constitutional medicine, which goes on for the patient for a long time. So that's all. I think we should take a move, and I will see you all again tomorrow evening, same time, and stay updated with my YouTube channel and Instagram and Facebook page for knowing more details of what's coming next.